Greetings and welcome to Instagram Live with Physiotherapists. Thank you all for joining us today on this pleasant evening. Hello, myself Bhavika P. I am a public speaker at Physiotherapists and a final year student at Banarsidas Chandiwala Institute of Physiotherapy, Delhi. I think let us wait for a few moments so that all people join in and then we can begin. Okay, so I would also like to thank the CEO and manager of Physiovet, Dr. Amrish Akre sir, for giving me this opportunity. Thank you so much, sir. And before I reveal the exceptional speaker for the day, I would like to add my co-host Akansha Asrani. Akansha Asrani is I should add her first. It's just a second. Yeah. An IAFC certified aerobics, group fitness and basic and advanced Pilates instructor who is studying in final year of D.Y. Patil College of Physiotherapy, Pune. I just send her the request again.
Hi Bhavika.
Hi Kansha.
Hi, how are you? I'm good. How are you?
I'm so esteemed to have you today with me. And so I think let's just continue. And it gives me great pleasure to introduce our speaker for the evening, Dr. Nitin Madan, sir, from Melbourne, Australia. Can you hear me?
Yeah, I can hear you.
Okay. So finally, it gives me great pleasure to introduce our speaker for the evening, Dr. Nitin Madan, sir, from Melbourne, Australia. I'll just add him.
Yeah. Hello, sir. How are you?
Hello, how's it going? Thanks for having me on. Can you hear me
hello,
okay?
sir. Good evening from India.
Hello.
Yes.
Hello, thanks for having me on.
Yes, you're audible.
So, Akansha and I are so excited to have you on board with us today, sir. And I would like to start this live by giving you a formal introduction to our viewers. So, I'll just begin. Dr. Nitin Madan, sir, is an Australian-based physiotherapist. Sir did his Bachelor of Physiotherapy with honours from Monash University and Graduate Certificate in Sports Physiotherapy Latrobe University. Sir is currently doing Masters of Sports Medicine from Melbourne University. He works at a Cricket Sport Medicine Centre, Victoria headquarters. Also, currently running his own clinic in Melbourne, Australia, focusing mainly on neuro and sports. It's a pleasure for Physiovet to have you on board with us, sir.
Thanks very much for having me on to be here. I think it's a wonderful thing that you guys are doing, your wisdom and everyone else's wisdom to all the people watching. So hopefully I can be of some assistance. I'll try and share as much experience as I can. It's only been a short journey for me so far, so hopefully some awesome ideas.
Yes, sir, definitely. Bhavika? Okay, I guess she's reconnecting. Yeah, give us some more. I think she has some network issues.
I think she's back.
Yeah, she's back. Yeah, she's back.
Sorry for the technical glitch, sir. So
that's okay, no problems.
I think let's start with our first question.
Yeah, let's begin with our first question. Sir, you have been practicing in so many varied domains of physiotherapy that includes neurology and sports physiotherapy. So would you like to tell us how your journey has so far as being a versatile physiotherapist?
Yeah, versatile is a good word. I like that word, actually. Yeah, so I actually met with a small accident when I was about 18. I fractured my back, had some disc problems playing cricket. And I had to have a small surgery, unfortunately. And I had to do a fair bit of rehabilitation, as you can probably understand. I think Bhavika's having some problems there again, but that's all right. I'll keep going and hopefully she can rejoin us. Yeah, so
you can keep.
I had to have surgery, and obviously, as you can understand, I had to do a fair bit of rehabilitation after that. So I sort of decided that sports physio was my pathway. And then I did, and then the clinic that I was working at that time did a lot of neuro work. So it wasn't my choice, but I fell into doing some neuro work. But then I realized that it wasn't really sports physio or neuro physio that really interested me. It was the type of person that I was working with. So when I was working with people that played sport, their goal was to get back on the field. When I was working with neuro patients, they had simple goals like I want to be able to walk again, I want to be able to sit up by myself again. So I like working with people that have clear goals, clear objectives, they're on a mission to achieve something, and I like being part of that journey. So I guess I'm lucky enough now to mix that along with my weeks, having sort of my own business and then working for a few others as well. I'm lucky that I can mix that and get the opportunity to work with goal-driven people for most of my week.
That's really nice to hear, sir. I think once you experience yourself, something, an incident or a trauma, and then you figure out that that's what you want to do, being a healer, that's a really nice story that we got to hear from you, sir. Thank you for sharing that with us.
Absolutely. I think every injury actually gives you a really good opportunity to learn. And I learned so much more from my back injury, back surgery, that then, as you guys probably understand, it helps you relate more to patients suffering that.
Yes, definitely.
Sir, the next question would be, nowadays we see that physios tend to stick to their own field of specialization. How important is it to explore various domains like women's cardio, pulmonary, ergonomics? Is it necessary to stick to the certain domain or shall vary in different specialties?
Yeah, I think the difference, as you guys were telling me before, in Australia it's a little bit different. We don't have to do a master's, it's our choice. Whereas I think in India it's a little bit different. When you finish the bachelor's, you guys were telling me you have to do a master's. So because we have it maybe a little bit easier here, that we can go straight into any domain, it gives you the opportunity to trial and test a few different things. The way I like to look at it is, you know, when we were children, when we were growing up, we all tried different sports. You know, we tried some cricket, maybe some football, basketball, and eventually you find something that you're really good at, something that you're passionate about, and then you go down that pathway. So I think until you trial a little bit of everything, you're not really going to know what you like doing or what you're naturally good at. So I'd encourage everyone to not just stick down one pathway, especially when you're young. When you're in your 20s, there's an opportunity to go out there and experience as many different things as you can. It's only going to make you a better practitioner. It's not going to make you any worse. So I think as long as the fields interact somewhat, like for me, it's all about, I'm interested in cricket, so I work in cricket. I really enjoy neuro. I do a little bit of neuro. So they're not totally random, if you know what I mean. They complement each other. Goal setting for an athlete is not that different from goal setting with a neuro patient. So in a way, they sound different, but they're actually somewhat similar. So I'm not doing things like, you know, women's health or things that are totally different. I'm not trying to delve into that. I'm trying to keep things as similar as possible, but different enough so that they're still exciting.
Yeah, I think it's really important that we try and follow our passion and try the varieties that are there. Sticking to one thing doesn't give that much outcome. If you are passionate about 2 things, 3 things, go for that only.
Spot on, absolutely.
Yeah.
Yeah, and if you're interested in a particular sport, like some sports really, it's your hobby or it really interests you, then you would definitely put in everything to make that person recover. So, yeah, that would really benefit even the patient and make us a better healer. So, yeah,
absolutely.
I totally agree.
Absolutely.
Yes.
And sometimes, the other thing I'd say is sometimes you don't know that something's a passion of yours until you try.
Yeah.
I didn't know how much I would enjoy neuro until I started doing it.
Correct. You have to try it. That's
Exactly.
okay.
Yeah.
Thank you, sir, for that. Moving on to the next question. What are the challenges that you faced in your practice? Would you like to throw some light on those hurdles that you had to, overcome?
Yeah, I guess if I talk about it from the very start, in Australia, our university education is very hospital-based. So the courses are excellent, but they're not that great if you want to work in private practice. So for me, starting out of uni and going straight into private practice, I had to learn a few things that we possibly didn't learn at uni. Some of those things were, communication skills. Time management was a big one for me. I love spending an hour with patients, but unfortunately in the private practice world, sometimes we only get 20 or 30 minutes. So some of the biggest hurdles for me was how can I do a really good consultation in 20 to 30 minutes and see it might be 10 patients in a row. And how can I repeat that over and over again with 10 patients in a row? How can I communicate effectively so that I can explain what I'm saying as quickly as possible, but the patient still walks out with a direct understanding? So they were the things that I had to learn probably after university. And then the other challenges came with starting a business. So starting my own clinic, I had to learn a lot of things. How do you build a website? How do you work a practice management software? How do you do bookkeeping? How do you do the billing? All those sort of things I had to sort of teach myself at some point. So those challenges came then. And I'm sure if you're interested, we can go into that a little bit later for anyone who's interested in starting their own practice and how to go about doing that.
Yeah, that would be really nice, just so that the people watching now and later would get a good insight if they want to be in Australia, what other things they have to educate themselves with before starting. It's like you're out there. It's like once you go out there, you just have to learn all these things alone. And it was really nice that we knew that it's not a cakewalk. It's the challenges that one must face before you become successful. Okay. Moving on to the next question. Sir, what are the diverse ways that your university used to enhance your skills, and how did doing that extra master's and then leaving it help you with what you are today?
Yeah. So I think the best thing that we learned at university is critical analysis or critical research skills. There's a lot of evidence that comes out there, and sometimes, the evidence can be quite conflicting. You might read one paper and it will tell you to do one thing. You might read another paper and it might tell you to do the opposite thing. So university helps to influence our research skills in the right direction. But then I think most of our learning happens once we finish university. I think when we finish university, we're like babies that have just learned to crawl. And then once we start in the real world, we sort of learn how to walk, how to run, and then how to do our various things. So I'd say university gives us a good preparation, but then I think in India, you guys have your masters, which gives you a lot more experience. For us in Australia, it's a little bit different. Like I said before, you don't have to do your masters here. And I think for me, my preferred learning style is definitely practical. I like getting to spend time with other physios that have more experience than me. Our master's program at that time was quite online based. So there was lots of writing on forums, there's lots of assignments. Personally, for me, after 1 year, I thought there was a better way that I could learn. So instead of continuing with that master's, I decided to reach out to some of the top physios in Australia and try and spend some time with them. And another tip I guess I could give was I didn't have a direct avenue, so I just emailed some of these people and said, look, I'm happy to pay you as a patient to spend an hour with you and pick your brain. And I found that a much more practical way to learn than, doing an assignment on something that I might not see for the next 12 months. So the other thing that we're blessed to have is we have a lot of courses on the weekend. So we have a lot of expert physios, and I'm sure you have it in India too, that give up their time on the weekends to run courses. So if you're seeing a patient and you're not quite sure, there's always a course in the near future that you can attend. And I think that knowledge is good because it's practical, it's relevant, you can use it straight away. I think at the start, I got into a pattern of getting a lot of information but then not applying it. And I didn't learn a whole lot from it. So I guess, yeah, to summarize, university gives us good research skills, but then your major skills like communication, exercise prescription, manual therapy, all of that I think you refine along the pathway afterwards.
That is actually insightful, and that actually really helps if like final year students or interns are listening to this, then yeah, practically we have a lot more to move ahead. It's not that we're done with our 4 years and we are doctors. No, to actually become something, spending time with great people who are experienced really adds a lot to our hands and makes us better healers. Like our great rightly says, we should have a healing hand, and for having a healing hand we have to practice. So for your answer, it was really lovely to hear that people believe in practical, and that should be how we physiotherapists should take back. Okay, so thank you, sir. Moving on to the next question.
Yeah.
Sorry,
so
Bhavika.
Next question would be, how can we challenges as it involves a huge amount of reading, evidence, risk-based research, and consult upgradation of knowledge. So what do you think, like, what would you suggest our viewers and how we can overcome these challenges?
Yeah, I think it can get very overwhelming if we're constantly reading research papers and trying to update our knowledge. And I think the first thing I'd suggest is try and find a simple way to do that. So whether you form a group with some of your other colleagues and you all summarize one paper or one topic every week, or there's plenty of, they cost money, but there's plenty of subscription-based things online where they give you research reviews. So I'm lucky enough that I've got access to a few of those as part of my business. So, you know, I get an email with a summary of some of the research articles. So I don't have to go and look through and read through all of the articles. But like I said before, I think we probably pay a bit too much attention to, you know, being always up to date with the research. I think what makes a bigger difference is the way we communicate with patients and how well we get them on board. 70% of it's going to be that. The basics don't really change. Even the time I've spent with physios that are a lot more experienced than me, they're not necessarily doing something new every week based on the research. They're just doing the basics really, really, really well. They're communicating really, really, really well. If you look at it, the foundations of anything really change based off one new research paper. So I think my answer to that question would be take the pressure off trying to always stay up to date and always stay relevant. Try and just do the basics and the fundamentals really well, and then always try and update a little bit, but don't put pressure on yourself to have to constantly be looking at papers and reading. Try and find an easier way to do that by getting your colleagues involved, so it can be fun as well.
Correct. Right, sir.
Okay, sir. Thank you for sharing that with us. Moving on to the next question. So since none of us are really aware, so we would like to ask you, what is the importance of biobehavioral approach?
Yeah, so I think it's as physiotherapists, we need to understand pain, right? And we know that many things influence pain. So patients' psychological health, their social health, all of those things are going to influence, especially chronic pain. I think as physiotherapists, we need to acknowledge what barriers to healing we might have. So the biggest ones for me are going to be sleep, nutrition, and stress. So I think as physiotherapists, we have to be able to recognize whether our patients are struggling with any of those areas. I don't think it's our job to fix those problems. I don't think it's our job to necessarily talk about a patient's personal life problems and try and solve them in the session. But I think it's our job to identify them and say, okay, I've identified that there's multiple factors that are influencing why your condition's not getting better. One of those factors is you're not sleeping very well at the moment. You're not sleeping well because I know you're going through lots of things at the moment. It's a difficult time for you. I've got a few colleagues who specialize in, let's say, psychology or dietetics, nutrition. I'd like you to go and meet this person to help you with that, which is going to ultimately influence your healing as well. So I think early on, I used to get into the pattern of talking too much to patients about what's going on in their lives and what their stresses are. But as you guys know, when you have 20 minutes or 30 minutes, and if you start to open up that area. Sometimes a patient can be talking for 25 minutes and you're like, oh, I've only got 5 minutes left and I haven't done much with them today. So I wouldn't these days go too deep into that. I would just acknowledge that it's there and then direct them to the right people. So it's important to have a network of other professionals that you refer to. And at the end of the day, people that specialize in the area are going to do a better job than we will anyway. Like, we're not psychologists, we're not dietitians. There's going to be people out there that will do that better, but we have to be the ones that kind of direct them down that pathway.
Correct. Yeah. Identifying the problem would be like the job of any healthcare worker, be it in any field. So it makes a lot of difference if somebody's health in another matter is affected, so their whole healing can be affected with that. So yes, reference would be the key, I guess. It was a golden key that you just enlightened us with, so thank you for that. We'll move on to the next.
If I can make another point on that, I think sometimes just talking to the patient when they're on the treatment table, sometimes we build that rapport with patients or that trust with patients, right? They may not want to go and see a psychologist after the first session. So they may want to come to you, and whilst you treat their injury, they may share a few things with you, and I think that's okay. If patients build that trust with you and rapport with you and they want to share what's going on whilst you're treating them, then I think that's okay. We can't also be too quick to run away from patients telling us anything, because at the end of the day, we are going to be a trusted person for them. So I think it's about knowing that, okay, this is getting beyond my scope. Now I need to refer, or some things just offering a listening ear, and that can make all the difference.
Yeah, that's
yeah.
So next question would be, like, according to you, is a multimodal approach always a good physiotherapy?
Yeah, I mean, I guess we talked a little bit about having a variety in your practice. So I'll answer this question based on what we do in the treatment room. So I think having lots of different modes of treatment is super important. These days, a lot of physiotherapists are focusing a lot on exercise prescription, and I think that's great. Every patient needs that. But I don't think we need to also forget about the manual therapy side of things as well. So I think if we do the basics really well from a manual therapy point of view, if we've got simple exercises, basic simple exercises that we can progress or we can regress really well, if we can teach our exercises perfectly, give really good cues, and we know how to adapt based on how a patient responds, I think we're going to get a good result. And then if we get some experience in other areas like neuro or ergonomics or typical day-to-day things that patients might face. Everyone, you know, a lot of people these days work at a computer desk, or because of COVID, they're working from home. So adding that layer of knowledge as to how they can take their rehabilitation or their injury healing to the next level, then just makes you into a better therapist. So yeah, get as much experience as you possibly can, communicate it well, and have your own system, have your own ideology on how you treat certain injuries based on the research, based on what's worked for you in the past, based on other professionals. Have your own kind of system that you go with. I think when I first graduated, I was very quick to change my method based on somebody else. I'd say, oh, this physio does this, or I read this paper, or this physio does that. And I'd be very quick to just change what I do. I think these days I've tried really hard to have my own systems and then just adding little bits and pieces based on what other people do.
So multimodal approach does help in healing a lot.
Definitely.
Yeah. Yeah, so if once you learn about what others are doing for this particular condition, and then you make it your own, and then once you get a result, and then you can actually make it your own and then treat the patient for a better result. So yeah, that definitely would take back this message. Thank you, sir. Moving on to the next question. So how can one set up their own clinic, and what are the skills that you need to acquire for setting up your own private clinic?
The first thing that I would say to everybody is don't feel pressured to set up your own clinic just because everybody else is doing it. When I first started, I used to see, you know, my boss or the owner of the business, and I used to think, oh, it'll be so easy to set up my own clinic. I'm going to do it. But it actually was a very difficult thing to do. So first thing I say is definitely don't put yourself under pressure to do it just because all your colleagues are doing it. It's perfectly okay to work for a business for your whole life. That's totally okay, because some people don't want that added stress. But if you do want to start your own clinic, there are also many, many, many benefits to it. I think you become a more rounded person because you force yourself out of your comfort zone. When I started my own clinic, I had no idea about a lot of things. Like I said before, I didn't know how to build a website. I didn't know how to make social media videos. I'd never published anything on social media before I started my clinic. So, this stuff, Instagram Live, whatever it might be, it forces you out of your comfort zone. It forces you to do things you wouldn't otherwise do. So I also think that you don't necessarily need to start a clinic to do that. You could do anything. If you're interested in running, you could start a blog on running. If you're interested in tennis, you could start an Instagram channel on tennis. If you do something that's out of your comfort zone, then it forces you to become a different person, a slightly better version of yourself. But if you do decide you want to start a clinic, then there are also many variations of that. When I first started, I didn't start a big clinic with 10 physios, or I literally started with a portable table, and I started in like a personal trainer's gym. I said to the personal trainer, I said, look, you don't use the gym during 12 p.m. to 5 p.m. How about I pay you some money, you give me that access to the gym, I'm going to bring a portable bed in and start that way. That's how I started my clinic. So very, very, very humble beginnings. But at the end of the day, if you do that, you do it with passion and you do it with 100% effort, then slowly the word gets out and people tell their friends and their friends tell their friends, and your business starts to grow. And based on that, then you can move to bigger and better locations. So yeah, if you want to start your business or start your clinic, I would have a very clear why. Why do you want to do it? Do you just want to make more money, or do you want to become a better version of yourself, or what's your true reasons for doing it? Because when it gets difficult, when it gets hard, you need to be able to resort to those whys. So, yeah, but I would definitely encourage everybody to start some sort of niche. Doesn't have to be a clinic, but some sort of small niche, just so you're pushed a little bit and you're forced out of your comfort zone.
Okay, yeah. So the hard work really pays off. Because,
for sure.
like you said, like how you said that you just had it for 3 hours and a portable table, and then you started from there. And look where you are now. You've become the best version of yourself. Yeah.
Absolutely, absolutely. And it happened naturally. I just did the best I could. And I was lucky enough that people got good results. And then, I was lucky enough that people said nice things about me, I guess, to their friends and family. And the business sort of grew from there.
Yeah, that's true. Once you believe in what you do, then definitely you get a payback for what you've done. Being being a healthcare worker, it really pays off. Doing good for people.
And same with my cricket stuff. At the end of the day, I just started a Instagram channel about cricket and just started sharing what I was passionate about, and slowly that attracted local cricketers, and then I was sort of offered a position at a club, and then that obviously grew from there as well. So again, if I hadn't taken the first steps and I hadn't put myself out there, then that never would have happened.
Yeah. It's about taking that opportunity and like striking, and then once you do that, you shine like you are today. So thank you for being so inspiring for all of us.
Thank you for all the motivation you are giving us right now.
You're welcome.
In sports like cricket, we deal with various levels of athletes, right from beginner to elite players. Like, how can we build a good rapport with players while working in a close association as physios?
Yeah, that's a really good question, and I'm going to be super honest with this answer. I think the first part is image. We have to look the part. Cricketers can be quite judgmental sometimes. So I'm not saying that as physiotherapists we have to have, six-pack abs and we have to be, more fit than the athletes, but we have to somewhat look like we know what we're talking about, okay? If you're going to be giving a cricketer, exercise advice or fitness advice, but you yourself look like you can't run 100 meters, they're not going to take you very seriously. So I'd encourage everyone watching if you want to work in cricket or if you want to work in sport, first of all, just start paying a little bit of attention to your own fitness. Again, you don't have to get yourself extremely fit and live in the gym, but just do a little bit so that when you talk about exercise, everyone knows that you're an active person. That'll be the first thing I'd say. The second thing I'd say is communication is very, very different. When we go to university and when we work in private practice or hospitals, we're taught to communicate very professionally. We're taught to articulate ourselves. We're taught to be, very respectful with our patients. And at a sporting club, that is slightly different. You don't have to be as professional. Your communication should be at the level of how the cricketers talk. So sometimes some of the physiotherapists that I've worked with in the past that maybe haven't done so well is because they've tried to use the same formal communication style in a cricket club setting. So at least in Australia, the players respect it if you talk to them at their level. And not necessarily like, professional trying to overburden them. So I always make an effort personally to talk to them just like I would talk to a friend. And I think that level of communication goes along better than trying to be very, very overly professional and, overcomplicating explanations, things like that. They would be probably my top 2 points. And then the third thing is just be prepared to do some things for free. So if you have to work with some local clubs for free and just do a really good job of it, then your opportunities will naturally come.
Yeah, like to build a good rapport, one should try to become like them, like talk to them like they talk. So it will definitely help us.
Yeah, absolutely. To a certain limit. Obviously, they're using a lot of bad language in the club room sometimes. You might not go to that level, but definitely bringing your professionalism down a little bit in terms of communication actually works really well when you're working in sport.
Yeah.
And then again, you have to tailor make your treatment based on the level at which that, the person coming to you is. Like, for example, we have a beginner or we have like a really highly advanced, one of the best players, you can say. So you do have to modify your fitness exercise prescription that you would give and tailor make it. Yeah, that totally makes a lot of sense. And the 3 golden points that we should highlight if you want to be a sports therapist. So all the people who want to become a sports therapist, please take notes. So it is giving a lot of enlightening information. Yes, so we'd like to go to the last and final question for today. That would be that, so would you like to please give us more these golden words of wisdom that you've already shared with us, but some more points that you would like to highlight for our global physiotherapy community?
Yeah, I guess a couple of points I'd like to make. The first thing would be, as we said before, don't be afraid to be versatile. Be brave, and if you can get an opportunity abroad to try anything, absolutely try it. Or even in India, absolutely try it. Get as much different experience in as many different domains as you possibly can. The second thing I'd say is use social media smartly. I had a friend the other day say to me, he looked at some of my neuro patients on my social media and he said, I didn't know physiotherapists treated people with brain injuries. I didn't know physiotherapists treated people with stroke. So the general public, the general community, they still don't really know fully what physiotherapists do. So I think if you do something that's different, if you do something that's a niche, if you do something that you're very passionate about, share it on social media. And that's the only way that people are going to get an idea of what you do. You don't have to necessarily share it in a way where you're saying, oh, look at me, I'm so good. But you can share it in a way where you're just, I guess you're just giving value to people by showing what you do and possibly by educating them. So I'd encourage everyone to not be afraid to do that. And I think the third thing I'd say is there's lots of people with very strong opinions out there that some of the new graduates or the freshers sometimes follow. So just be a little bit careful. Some people are very anti-manual therapy and only do exercise, and some people are, very strict on their methods. So I think you've got to keep a very open mind and be very careful of anyone that has strong opinions. Develop your own systems, develop your own methods, and then whatever you learn, whatever you like based on someone who you see, just add 1 or 2% onto your own system. But until you develop your own system, just be careful of being too influenced by anybody.
Mm-hmm. Yeah.
also, sir, there was a question in comment box. Like, what would you like? What message would you like to give for Indian students who are dreaming to study overseas?
Yeah, so I guess I can't comment on how difficult it is to come from India to here because I was lucky enough that I did my studies here. So I don't know logistically around visas and things like that, but I can only comment on the sort of person you need to be to do well when you come here. So as I said before, I think image is going to be key. So work on your personal brand, your personal image. That's not just the way you look, but also about how you communicate. Work on your voice, your tone, so that when you talk to patients or when you talk to teams, people perceive you as being confident, people perceive you as being articulate, and that will just help stand out when you come here. I'd also say that your clinical skills are important, but your treatment planning is going to be more important. So what I mean by that is if a patient comes in with a particular injury, how are you going to treat them session 1, 2, 3, 4, 5, 6? How are you going to progress your treatment practically? That's going to be super important. And then if you work in a team, if you're coming here to work with a sporting club or something like that, you need to be able to communicate with the coaches, strength and conditioning, the dietitians, all of that stuff as well. So again, that boils down to teamwork and how well you do that. So if you work on those 3 things, then at least if you do get the opportunity to come here, you'll be ready.
Yeah. Okay.
I think that summed up everything that we wanted to hear. Thank you, sir, for sharing all this with us. And now we'll have Bhavika with the vote of that.
Thank you, sir, for enlightening us in so many aspects today. It was so prestigious to have you on board with us. We are looking forward for more lives with you in future. And thank you for all the information you have provided us today with this small live chat of ours.
You're welcome. You're welcome. I had a lot of fun, and I'd love to do it again in the future. Good luck to both of you and to everybody watching.
Thank you so much, sir.
Thank you, sir.
And thank you for this live. And a very warm thank you from the whole team of Physio and along with all the viewers watching today with us. Stay tuned on Physio for more live. Thank you.
Thank you.
Thank you so much.